Hello, this is Andrew Hetzler with American Exchange. Going to walk you through a couple different pathways of submitting an enrollment through the Broward Regional Health Planning Council site. Broward Regional Health Planning Council is contracted by Florida Department of Health to provide insurance benefit management services. And American Exchange is working with BRHPC to help with the insurance enrollment part of that contract. So here I am at the enrollment site. We've got the URL right here, https://enroll.org. So that's the site that you want to go to get to both of these enrollment pathways. So that might be good to bookmark that particular page. If we get into this site, you're going to see two options here. The one on the left is for clients that have not yet enrolled in a health insurance plan for 2020. So take this pathway if you, as a client or as an assister, are helping someone enroll for 2020. This pathway here on the right is for someone who has already successfully enrolled in an approved plan. So if you've already enrolled in a marketplace plan, you would use the form on the right. If you need assistance with enrollment and have not completed a marketplace application, use the form on the left. So getting into each form, we're going to click into this one first, that I have not enrolled yet. At the top of the screen, you'll see BRHPC's logo, and also if you need assistance, you can also call in to the dedicated line here, and you'll see this number in a couple places, 844-441-4422, and you'll also see it here in the form as well. So here is where we'll get into the particular form. There's some disclaimers here. If you do use this form, American Exchange can act as your agent broker for the 2020 plan year, meaning that you can come to us for any customer service needs. We'll make sure that your marketplace plan is enrolled properly, and we can act as a customer service unit for the marketplace and for the health insurance carrier that you choose. So the first couple questions on this form, we're asking who is completing the questionnaire. So if you're completing for yourself, I am the primary applicant, you would select this first option. If you're an assister completing this on behalf of someone else, you would select the second option here. An assister can be anyone from a navigator, a family member, a case manager, or a social worker, or anything. So if you do select that option, it is going to ask for the name of that person. You can also put in their email and their phone number. But the mandatory field here for if you are an assister, we would ask for your name. The next question is if you are new to the marketplace or if you're renewing coverage. If you're new, there's no additional fields to answer. If you are renewing, we would like to know who you had coverage with this year, 2019, so that we can make sure everything's enrolled properly. So there's a drop down here of 3 health insurance options. If you're not sure what carrier you had in 2019, but you know you had marketplace coverage, you can select I'm not sure. If you have your member ID, that is also helpful, and your 2019 plan name, that's great. That's going to help us process the marketplace enrollment, but it's not required. Moving on, we've got the primary applicant information. All of this should be pretty self-explanatory. I'm just going to go through and complete some of these fields. You have to use this calendar feature to submit the date of birth, and social security number. On the address, if you just start typing, it should pull up your address. So you would just click that and it autofills. Pretty simple there. Phone number. An email address is not required, but is very helpful. And then if you're a tobacco user, you'd select yes or no. If you do select yes, it's going to ask you the date of last use. Most of our clients, if they are tobacco users, use every day. So you would just select today. However, if you quit a few months ago, you want to put the date that you quit, you're welcome to provide that also. Moving on to the household information, what we're asking is for people that are any additional people that are in your tax household. So many of the applicants are single and are applying for only coverage for themselves, but you may have dependent children or a spouse that are not covered on the health plan. You need to list those clients, or excuse me, those individuals on this application so that we can accurately determine the tax credit amount for your plan. So there's an option here for up to 10 different people within a household. Okay, if you select 0, you're basically saying, hey, I'm single, I claim no dependents. Okay, so that's probably going to be pretty frequent. If you do have other family members, though, it is going to be required for you to describe their relationship, whether they're a spouse, a dependent child, or another dependent relative, their gender, first name, last name, and date of birth. Okay, and there's up to 10 spots. So if you have a household of 10, you're going to have to provide this information for all 10 members of the household. But you would just kind of select how many here with the drop down, and it'll produce that many additional fields for you to put that in. For this demonstration, we'll just go through with 0. The next section is the income information, and it's asking if you'll be receiving any of the following types of income for 2020. If you are, you would select yes. There's some more information here about what type of income is included. So if you have any questions about that, you can just click on this link here. It'll take you to some great information from healthcare.gov. But if you do select yes, you are going to be required to complete at least one type of income. Okay, so what you want to do is you want to list the type. If you select salary, wages, tips, and commissions, it's going to ask the name of your employer. If you select self-employment income, it's going to ask the nature of your self-employment. But otherwise, all of the other income types, it's going to ask you who is the income earner, whether it's the primary applicant, spouse, or maybe some other person within your tax household. So if your spouse is working, makes $20,000 annually, the frequency here, annually, and maybe they're an Uber driver. That's how you would list that. If you do have a household where there's multiple incomes, please list each type of income on a separate row. So it's helpful for us to complete the application properly to have each type of income listed out, rather than you trying to aggregate your or add up all of your household income into one item. So moving past the income, we do have, we go into the tax information. So you would select how you plan to file income taxes in 2020. Single, married filing jointly, married filing separately, head of household, claimed as a dependent, qualifying widow, widower. Do you plan to file income taxes in 2020? Yes or no? You do have to file income taxes to receive a tax credit, just for your information. And then there's an option here for you to be able to provide their 2018 tax documentation. So if you're willing to provide that, you would select yes, and you can upload the items that are necessary for the program. So the first page of your 2018 1040, your Form 1095, and your Form 8962. And if you click on this, any of these upload fields, it'll take you into your file tree, and you would just simply choose a file to upload for those items. However, if you do not, if you're not willing to provide that, there is an attestation here saying that by selecting no, you are refusing to provide the documentation. Moving on to citizenship and naturalization questions, you want to select if you're a United States citizen or a naturalized or derived citizen. If you are naturalized or derived, we'd like to know what type of status that you hold. So you can select that here. You can also enter any numbers or pertinent information from your documentation in this section. Or what we really suggest is uploading a legible image or copy of your citizenship documentation. So it works very much as the same as the other upload. You just want to hit this button, it'll go into your file tree, and you can select your copy of your proof of documentation. Moving on to other questions, if you're an American, if you're Native American or Alaskan Native, if anyone is offered health insurance in your tax household through an employer, and if you're a female on the application and currently pregnant, this is a Medicaid determination question. So these are 3 mandatory questions. Then we get into prescription drug information. So if you have any prescription drugs that you're taking and you want us to check that they're covered by your health plan, please enter those here. So you may enter a drug, the dosage, and the frequency. As much as you can provide is helpful, but this is an optional section. Then we get into the medical provider information. If you have any doctors that you want to make sure are in network, we'll check those and make sure that you're in a plan that fits your needs. Simply list the name of the doctor or the hospital. If you have their phone number, that's great, but it's not required. And we will check to verify that doctor's in network. Getting into any special enrollment period, since we're in open enrollment right now, today is November 1st, we're doing open enrollment until December 15th for 2020 plans. However, after December 15th, there are special enrollment periods, so this form will be open year-round. So if you or someone you're assisting has a qualifying event, you would just simply indicate that here in this section. And then finally, we're down to the end of this form, and it's asking if you have already selected a health plan for 2020. If you select no, American Exchange is going to take this assessment and get you into a health insurance plan that is both cost-effective and also fits the needs based on the information provided in this assessment. There's an open text field here, so you can say any kind of additional information, any kind of special instructions you're welcome to put in here. Otherwise, if you select yes, there's going to be a drop-down of the approved plans. And these may vary by county, but it will give you a pop-up of all the approved plans. You have to check each of these disclaimers, and then you're able to hit submit. Now, I'm sure I forgot a required field, but we'll see what happens here. Okay, I guess I got all the required fields. So if you do this, you will get a successful submission screen here, and you can now close this page. However, I'm just going to hit the back button to go back to the site. So I can also show you the form for I've already enrolled. So I'm going to go to the other side of the site. This is for I have already enrolled in a plan. I enrolled myself, or I work with another agent broker, or I have already gone through the enrollment process and I just want to input my information into BRHPC so that I can be eligible for the insurance program. So here is some more information about BRHPC and the relationship, and then also getting just back into that same primary insured information. So this is your information. This form is much shorter, so this is going to be a bit more simplified. There's basically put this information in on yourself or the client that you're assisting. And then we get into their 2020 health plan information. So basically this is all the information that would be provided through an enrollment through American Exchange. We just need to know the health insurance carrier that you're with, the health plan name, and this is the same drop down of approved plans as the other form, and then your subscriber ID number. Now this is a required field, and the reason we put these customer service numbers here is that typically you can call in and get your subscriber ID number for 2020, even though you may not have it right away. It typically takes 24 to 48 hours to get that produced. So if you don't have that, call into one of these customer service lines based on the plan that you enrolled with, and you should be able to get that. Also the date that you completed the application. So if you did your application today, you'd select November 1st. Your Marketplace app ID, the plan effective date, which should be January 1st, 2020 if you are enrolling during open enrollment. And then we're also asking for your premium information. This is very important that you get this accurate. Full premium before the tax credit is applied, the monthly APTC that you may be eligible for, and then the monthly gross after the premium tax credit is applied. We do also prefer that you upload your Marketplace eligibility results here. So this is a mandatory field. Same idea, you'll just click this option and choose the file out of your hard drive. And then there's an optional upload for a billing statement from your health insurance carrier. So if you have your January bill, that'd be great. We would love to have that to verify your coverage, but it's not required to complete a form. And then finally, disclaimers and notices. So you have to check each of these 3 to submit. Once you submit successfully, you'll be taken to that same successful submission screen, and you'll also receive a confirmation email both when a plan is entered and when an application is produced. So I hope this was helpful. If you have any questions or need assistance, be sure to call this number, 844-441-4422. Otherwise, you can reach out to BRHPC directly at that number. Happy to help out in any way that we can if there are any questions. Thanks. Hope you have a great day.